Hi, I'm here for my appointment. I have to warn you, I'm absolutely terrified of dental work. My hands are already shaking.
I completely understand. Many of my patients feel the same way. Let me know if you need a break at any point, okay?
Okay, thanks. So, what exactly are you going to do today? I need all the details before we start.
We're just doing a routine cleaning and checkup. I'll examine your teeth, clean them gently, and we'll discuss any concerns you might have.
Will it hurt? Because last time I went to a dentist, it was awful. I couldn't eat properly for 3 days.
This shouldn't hurt at all. If you feel any discomfort, just raise your hand and I'll stop immediately.
You promise? Because I'm seriously considering running out that door right now.
I promise. Let's get you settled in the chair. Would you like some headphones to listen to music? It helps some people relax.
Yes, please. Anything to distract me. Do you have any jazz? That's my favorite.
Absolutely. Now open wide and let me take a look. You're doing great already.
Okay. Wait, what's that sharp thing?
Just a mirror to see your teeth better. Nothing sharp will touch you yet. Take a deep breath.
Breathing. I'm breathing. Oh God, is that my molar? Does it look bad?
Everything looks pretty good, actually. You've been flossing regularly, haven't you?
Yes, every single night. I'm obsessive about it because I don't want cavities.
Well, it's paying off. Your gums are healthy and I don't see any immediate problems.
Really? That's amazing. So I don't need any fillings or anything scary?
Not today. Just keep up the good work with your oral hygiene and you'll be fine.
Oh, thank goodness. I was so worried. Can I book my next appointment for 6 months from now?
Absolutely. See? That wasn't so bad, was it?
No, you were right. Thanks for being so patient with me, doctor.
Come in, Ms. Rodriguez. What brings you in today on such short notice?
My tooth is killing me. I've been taking painkillers every 4 hours, but nothing helps anymore.
How long has this been going on, and which tooth exactly?
About 5 days now. It's this one on the bottom right. I can barely sleep at night.
Let me take a look. Open your mouth and point to the exact spot that hurts.
Right there. Oh, be careful. Even touching it with my tongue makes me want to scream.
I can see significant swelling around that area. Have you noticed any sensitivity to hot or cold foods?
Yes, hot coffee feels like torture. Cold water's even worse. I've been eating nothing but lukewarm soup.
This looks like an abscess. We'll need to do an X-ray to confirm, but you likely need a root canal.
A root canal? That sounds terrifying. Is there any other option? Can't you just pull it out?
We could extract it, but saving your natural tooth is always better if possible. Root canals aren't as bad as people think.
Everyone says they're horrible, though. My sister had one and complained for weeks.
Modern techniques have improved dramatically. I'll use local anesthesia so you won't feel the procedure at all.
Will you be able to do it today? I can't take this pain anymore.
Let me check the X-ray first. If it's what I think it is, I can schedule you for tomorrow morning.
Tomorrow? Can't you do something right now to help with the pain?
I'll prescribe you stronger antibiotics and pain medication to get you through tonight.
Thank you so much. I was desperate. My boss was getting annoyed with me leaving work early.
Dental pain is no joke. Make sure you take the full course of antibiotics, even if you start feeling better.
I will. Should I avoid any specific foods tonight?
Stick to soft, lukewarm foods, nothing sugary, and definitely no alcohol with these medications.
Got it. Thanks, doctor. I really appreciate you fitting me in today.
So this is my first cavity ever? How did this even happen? I brush my teeth twice a day.
Brushing is great, but brushing alone isn't always enough. Do you floss regularly?
Honestly, maybe once a week. My orthodontist keeps telling me to do it more.
That's probably the culprit. Food particles get stuck between teeth where your toothbrush can't reach.
Okay, but what exactly is a cavity? Like, what's happening inside my tooth right now?
Great question. Bacteria in your mouth produce acid that eats away at your tooth enamel, creating a hole.
That's disgusting. So there's literally a hole in my tooth.
A small one, yes, but we're going to fill it today before it gets bigger.
Will the filling hurt? My friend said she cried during hers.
I'll numb the area completely first. You might feel pressure, but no pain. If anything hurts, tell me immediately.
How long does the numbing last? I have a presentation at school this afternoon.
Usually 2 to 3 hours. You might feel a bit strange talking, but you'll be fine by afternoon.
What's that drilling sound? It's really loud and kind of scary.
That's the drill removing the decayed part of your tooth. It sounds worse than it feels, I promise.
Can I get a different color filling, like blue or something cool?
These fillings are tooth-colored to match naturally. They're much better than the old silver ones.
My grandpa has silver fillings. Are those bad?
Not bad, just older technology. The composite resin we use now looks better and bonds more effectively.
How can I prevent getting more cavities? I really don't want to come back for this.
Floss daily, limit sugary drinks and snacks, and keep up with your regular checkups. Simple as that.
What about mouthwash? Does that actually help, or is it just marketing?
Fluoride mouthwash can definitely help strengthen enamel. Look for ones with the ADA seal of approval.
Cool. Thanks for explaining everything. I feel way less nervous now.
That's what I'm here for. You did great today. See you in 6 months.
I only have 40 minutes. I have a conference call at 3 o'clock that I absolutely cannot miss.
Then I suggest you put your phone away so we can work efficiently. This is a crown replacement, not a quick cleaning.
Fine, but please hurry. Can't you speed up the process somehow?
I work as quickly as safety allows. Would you prefer a rushed job that fails in 6 months or quality work?
Quality, obviously. Sorry, I'm just stressed. Work has been insane lately.
I understand, but dental work requires precision. Now, let me examine the existing crown first.
What's wrong with it? It feels fine to me.
There's decay underneath. You mentioned sensitivity to sweet foods during your last visit, remember?
Oh, right. I forgot about that. So you need to remove this crown completely.
Yes, clean out the decay and fit you with a temporary crown today. The permanent one takes 2 weeks.
2 weeks? I have client dinners scheduled. Will the temporary crown look weird?
It'll look perfectly natural. No one will notice, but you need to be careful with hard or sticky foods.
Like what specifically? I eat out constantly.
Avoid chewing ice, hard candies, caramel, taffy, basically anything that could pull the crown off.
That's half my diet. Can I still drink coffee?
Coffee's fine. Just be mindful of the temperature initially. Nothing extremely hot for the first day.
Okay, I can manage that. Will there be pain afterward?
Some sensitivity is normal. Take ibuprofen if needed. Call immediately if you have severe pain or the crown feels loose.
Got it. Can I talk during the conference call after this, or will my mouth be too numb?
The numbness will affect your speech for a couple hours. I'd reschedule that call if possible.
Great, just great. My assistant is going to kill me.
Dental health comes first. Your teeth literally support your ability to do your job every day.
You're right. I've been neglecting this. I'll try to be better about regular checkups.
That's what I like to hear. Now let's get started. Open wide and try to relax.
Good morning, doctor. I'm here about this loose tooth, but I'm worried about how much it's going to cost.
Let's examine it first and see what we're dealing with. Then we'll discuss all your options and their costs.
It's been getting looser for months. I kept hoping it would somehow get better on its own.
Unfortunately, teeth don't heal themselves like that. How much pain are you experiencing?
Not much pain, really. just discomfort when I eat, and I'm embarrassed because it's a front tooth.
I can see why that would bother you. Let me check the surrounding teeth and gums too.
My gums bleed sometimes when I brush. Is that related?
Yes, it indicates gum disease, which is likely why the tooth is loose. We need to address both issues.
Oh dear, that sounds expensive. I'm on a fixed income since my husband passed away.
I understand completely. We have payment plans available, and I'll be honest about what's essential versus optional.
Thank you. Some dentists just want to do the most expensive procedure possible.
Not in my practice. Your tooth can probably be saved with a deep cleaning and better home care.
Really? You don't need to pull it out?
Not yet. If we treat the gum disease now, the bone can stabilize and hold the tooth better.
What would that treatment involve exactly?
A deep cleaning called scaling and root planing. We clean below the gum line to remove bacteria and tartar.
Will it hurt? I have a low pain tolerance these days.
We'll numb the area thoroughly. You might have some soreness afterward, but nothing unmanageable.
And how much does this cost compared to just pulling the tooth?
The deep cleaning is actually more expensive initially, but saving your natural tooth is worth it long term.
Because replacing it would cost even more, right?
Exactly. A dental implant or bridge costs significantly more than treating the gum disease now.
That makes sense. Can I pay in installments?
Absolutely. We can set up a payment plan that works with your budget. No interest charges either.
You're very kind, doctor. When should we schedule this treatment?
As soon as possible to prevent further bone loss. How does next week look for you?
Mrs. Chen, today we're going to use our new digital scanning system instead of traditional impressions. You're going to love it.
Wait, what? I thought you were taking those molds like last time. What's wrong with the old way?
Nothing's wrong with it, but this is so much better. No more gagging on impression material.
I don't know about this. New technology always makes me nervous. What if something goes wrong?
I promise it's perfectly safe. We just scan your teeth with a small wand. It's actually quite fascinating to watch.
Can't we just stick with what we know works? I hate being a guinea pig.
You're not a guinea pig. This technology has been tested extensively. Major universities use it now.
But you just got this machine, right? You're still learning how to use it?
I've completed full certification training. Plus, I've already done this procedure on over 50 patients successfully.
And they all liked it better than the traditional method?
Every single one. No messy materials, no gagging, and the results are actually more accurate.
More accurate? How is that possible?
The scanner captures thousands of images per second, creating a precise three-dimensional model. Human error is eliminated.
Well, when you put it that way, it does sound pretty impressive. But what if I still don't like it?
Then we stop immediately and use traditional impressions instead. You're in complete control here.
Okay, I suppose I can try it. But explain everything you're doing as you go.
Of course. So I'm inserting this small scanner wand. Just keep your mouth open and try to stay still.
This feels weird. How much longer?
Almost done. See? Only 2 minutes and we have perfect images. Look at the screen here.
Oh my goodness! Is that really what my teeth look like? That's amazing!
Right? And now I can show you exactly where we'll place the crown and how it'll fit.
I can actually see it before you make it?
Yes, we can adjust everything digitally before sending it to the lab. This way, there's no surprises.
I have to admit, Doctor, this is actually pretty cool. Maybe I was wrong to be so skeptical.
It's natural to be cautious about new things, but sometimes innovation really does improve our lives.
You've convinced me. Next time, I won't give you such a hard time about your fancy gadgets.
So my tongue has been really sore around my piercing lately, and my front teeth feel weird.
How long have you had this tongue piercing?
About 8 months. It healed fine initially, but now there's this constant irritation.
Let me examine your mouth. Open up and stick your tongue out as far as you can.
Is something wrong? You're making a concerned face.
I'm seeing significant damage to your front teeth. The metal bar is wearing away the enamel.
Wait, seriously? But I'm careful. I don't click it against my teeth or anything.
Even unconscious contact causes damage over time. See these chips and grooves? That's from the piercing.
Oh no, my teeth look horrible. Can you fix them?
Yes, but we need to discuss whether you're willing to remove the piercing permanently.
Permanently? I just got it. It's part of my style. Can't you just fix the teeth?
I can repair the damage, but if you keep the piercing, it'll just happen again.
This is so unfair. Nobody told me it could mess up my teeth this badly.
Unfortunately, many people aren't aware of the dental risks. The jewelry constantly traumatizes the tissue and teeth.
What about my gums? Are they okay at least?
Actually, I'm also seeing early signs of gum recession around those front teeth.
This keeps getting worse. What does gum recession mean?
Your gums are pulling away from your teeth, exposing the roots. It can lead to sensitivity and eventual tooth loss.
Tooth loss? I'm only 20 years old. That can't happen to me.
It can if the damage continues. I've seen patients lose teeth from oral piercings.
Okay, you've scared me enough. What if I switch to a plastic bar instead of metal?
That's slightly better, but any jewelry there still causes problems. Have you considered other piercings instead?
Like what? I wanted something visible, but not too extreme.
Ear piercings don't affect dental health. Even facial piercings are generally less problematic than oral ones.
I guess I could get another ear piercing. How much will fixing my teeth cost?
Depending on the extent of bonding needed, probably between $800 and $1,500.
That's my whole savings. I should have researched this before getting pierced.
It's a tough lesson, but better to learn it now than after losing teeth. Should we schedule the repairs?
Yes, please. And I'll take the piercing out tonight. This really isn't worth it.
Thanks for seeing my daughter today. She's 16 and terrified, so I wanted to ask questions first.
Of course, it's completely normal for parents to be concerned about wisdom teeth removal. What would you like to know?
Is this surgery really necessary? Her teeth aren't bothering her at all right now.
The x-rays show her wisdom teeth are impacted and growing at wrong angles. They'll definitely cause problems later.
What kind of problems are we talking about? Like pain or something worse?
Impacted wisdom teeth can cause infections, cysts, damage to adjacent teeth, and severe pain. Prevention is much easier than treatment.
But surgery sounds so scary. Will she be completely unconscious?
We have options: general anesthesia, IV sedation, or local anesthesia with oral sedation. We can discuss which feels right for your family.
What do you recommend? I want whatever's safest for her.
For impacted wisdom teeth in a nervous teenager, I typically suggest IV sedation. She'll be comfortable and won't remember anything.
How long does the actual procedure take?
Usually 45 minutes to an hour for all 4 teeth. It depends on how difficult the extractions are.
And the recovery? She has exams coming up in 3 weeks. Will she be okay by then?
Most patients recover within a week to 10 days. She'll need 3 or 4 days off school initially.
What about pain management afterward? I don't want her suffering.
We'll prescribe appropriate pain medication and anti-inflammatories. Ice packs help tremendously in the first 48 hours, too.
Can she eat normally after surgery? She's a vegetarian, so I need to plan appropriate meals.
Soft foods only for the first few days. Smoothies, yogurt, mashed potatoes, soups, nothing hot initially, and definitely nothing that requires chewing.
What about straws? She drinks everything with straws.
No straws. The suction can dislodge blood clots and cause dry socket, which is extremely painful.
Dry socket. That sounds terrible. How do we prevent it?
No straws, no smoking, gentle rinsing only, and following all post-operative instructions carefully. Most people never experience it.
What are the chances of complications? I need to know the risks.
Serious complications are rare. Some swelling and bruising is normal. Infection occurs in less than 5% of cases.
Will her face look really swollen? She's very self-conscious about her appearance.
There will be some swelling, yes, but it peaks around day 3 and then improves. Chipmunk cheeks are temporary.
Is there anything I should prepare her beforehand?
Make sure she has a responsible adult to drive her home and stay with her. Stock up on soft foods and ice packs.
I'll take the whole week off work to take care of her. When can we schedule this?
Let me check the calendar. How about 2 weeks from today? That gives you time to prepare.
Thank you so much for seeing me on such short notice. I chipped my front tooth, and I'm getting married in 3 weeks.
Let me take a look. Deep breath, okay? We'll fix this. When did the chip happen?
This morning, I bit into a piece of hard candy and felt something crack. I almost had a panic attack.
I understand the stress, but this is completely fixable. The chip is small and only affects the enamel.
Are you sure? It looks huge to me. I can't have ugly teeth in my wedding photos.
I promise, we can make this tooth look perfect. Better than before, actually.
What's the procedure? Will it hurt? And most importantly, how long will it take?
We'll use composite bonding. I shape and color match material to your tooth. It takes about an hour and it's painless.
An hour? That's it? I thought I'd need a crown or something complicated.
Crowns are for more extensive damage. This is a simple repair that'll last years with proper care.
Will you be able to match the color exactly? My teeth are pretty white because I just had them whitened.
Perfect timing, actually. It's easier to match bonding to freshly whitened teeth. The color will be seamless.
Oh, thank goodness. My photographer is so expensive. I need everything to be perfect.
Your smile is going to look beautiful. Now, let's get started. Any sensitivity to temperature?
Not really. Should I be worried about that?
No, just checking. The fact that there's no sensitivity means the nerve wasn't affected.
That's good, right? My fiancé keeps telling me I'm overreacting, but this is serious.
It's your wedding. You have every right to want everything perfect. Hold still while I shape this material.
Can you make it look natural? I don't want it to look fake or plastic.
The composite resin I use has natural translucency. It'll blend perfectly with your other teeth.
How do I take care of it? Can I still drink coffee?
Yes, but be aware that bonding can stain over time, just like natural teeth. Keep up your regular hygiene routine.
What about eating? Are there foods I should avoid?
Avoid biting directly into hard foods with that tooth. Use your back teeth for anything crunchy.
So no more hard candy. That's what got me into this mess anyway.
Exactly. Hard candy is terrible for teeth in general. Stick to chocolate if you need something sweet.
Done. I'll live on chocolate until the wedding. How does it look now?
Take a look in the mirror. Can you even tell which tooth was chipped?
Oh my gosh, it's perfect. I literally can't see any difference. You're a miracle worker.
Just good dentistry. Congratulations on your wedding. I'm sure you'll look stunning.
I haven't been to a dentist in 15 years. I know that's bad. I just couldn't bring myself to come.
You're here now, and that's what matters. Can you tell me what's kept you away?
Bad experience in the military. Dental work without proper anesthesia. It was brutal.
I'm so sorry you went through that. That should never have happened. We'll go at your pace today.
I appreciate that. My wife finally convinced me to come. She says my teeth are getting bad.
Let's do a gentle examination first. I won't do any treatment today unless you specifically ask me to.
Really? You're not going to push me into procedures?
Never. You're in control here. If you need me to stop at any point, just raise your hand.
Okay, that helps. What are you going to look for?
Just checking for cavities, gum disease, and overall health. I'll explain everything I see.
Fair enough. Let's get this over with.
Opening your mouth now. Take deep breaths if you start feeling anxious.
That's not so bad. What are you seeing?
You have several cavities that need attention, and your gums show signs of disease, but nothing unfixable.
How many cavities exactly?
5 that I can see. They're at different stages. Some are small, a couple are more advanced.
5. That's worse than I thought. Will you have to drill them all?
Eventually, yes, but we'll tackle them one at a time. No marathons, short appointments only.
I can handle that. What about the gum disease?
You need a deep cleaning. We'll numb your mouth completely so you won't feel anything uncomfortable.
The numbing needles are what really got to me last time. The dentist just jabbed them in without warning.
I use a topical anesthetic first to numb the area before the injection. You'll barely feel it.
That would make a huge difference. I can handle pain, but I need to be prepared for it.
Absolutely understandable. Your body's been through trauma. We'll respect that.
Thanks for not making me feel like an idiot about this.
Dental anxiety is incredibly common, especially for people with traumatic experiences. You're not alone.
So what's the plan? When should I come back?
Let's schedule the deep cleaning first in 2 weeks. Then we'll address the cavities one by one.
2 weeks gives me time to mentally prepare. That works for me.
Perfect. And remember, you can call anytime if you have questions or concerns before your appointment.
I might take you up on that. My wife will be happy I actually followed through today.
You should be proud of yourself. Coming here after 15 years took real courage.
It did, didn't it? Okay, let's book that appointment before I change my mind.
Done. See you in 2 weeks. You're going to be just fine.